Well, hello everyone. Wonderful to see the guests I can see at the top of my screen, and I hope that there are plenty of you joining as well for the conversation that's going to follow. My name's Vaughan. I'm so delighted to welcome you all here today to discuss the 2021 WHO World Malaria Report, and of course, crucially, how the UK government can continue to lead the way in the fight against this disease. Now, each year, the publication of the World Malaria Report is an opportunity to reflect on all of the brilliant progress that has, of course, been made against this disease, but also to assess what more can be done to accelerate the fight against malaria so that we can actually eradicate this disease for good. Now, we have a fantastic panel of speakers for you today, and I would also encourage all of the guests in the audience to pose your questions as the conversation is going on, and then we will try and find time towards the end of the discussion for a Q&A session. So please do pose your questions, and I'll try to get to as many of them as possible. You can also tweet along through the course of the event using the hashtag World Malaria Report and also hashtag End Malaria. We'd be grateful to see as much coverage of this as possible through social media. But to kick us off, I would like to introduce Baroness Heyman, who is the chair of Malaria No More UK and also the vice chair of the All-Party Parliamentary Group on Malaria and Neglected Tropical Diseases. A few introductory remarks from Hélène, and then Hélène will introduce our keynote speaker. So over to you.
Anna, thank you very much indeed. The last couple of years, the world has been focused on a new global health threat. Last couple of weeks, we've been focused on a new global health threat. But I think Monday's publication by the WHO of the annual World Malaria Report just reminds us that there is a very old global health threat, and that threat, far from going away, as the data has shown in that report, has actually been getting worse, with year-on-year malaria deaths rising to the highest level in nearly a decade. About 627,000 lives were lost to malaria in 2020, and it really must serve as a wake-up call to the world that we mustn't neglect malaria in our struggle against COVID. And sadly, as ever with malaria, it's children that are bearing the brunt. In 2020, 80% of malaria deaths in Africa were among children, nearly 500,000 children under 5 losing their lives in Africa alone. And Africa region accounts for 95% of all malaria cases, 96% of all deaths from malaria. And the region saw a 12% increase in malaria deaths in 2020. So I think we have to recognize that the fight against malaria is at a precarious junction. And as Hannah said, we've made a great deal of progress in the last decade. Remarkable progress. The death rate globally from malaria fell by 51% between 2000 and 2015, in large part because of the massive scale up that we had in the use of malaria tools that prevent, that detect, and that treat the disease. And in that time, we probably saved over 10.6 million lives and presented, and these figures are extraordinary, over 1.7 billion malaria cases. But if we don't put right what is happening at the moment, if we don't reverse that trend, then, as we always see in the fight against malaria, we don't go onto a plateau. We go downwards, and we go downwards very steeply. It's one of the things I've always been proudest about in the UK is that we have been at the forefront of events as a country, together with the US, who's the largest international donor. We've been the second largest donor. We've helped in that tremendous achievement over the 15 years. And I think that the one thing that I'd like to say today is that it's absolutely essential that the UK government continues to play a leading fight in the ongoing struggle against malaria. But you have expert panelists that I'm looking forward to listening to. And we're very lucky to have with us Vicky Ford, MP, with us on film, I think, Parliamentary Under-Secretary of State and Minister for Africa, so very relevant to this subject at the Foreign, Commonwealth and Development Office. She's our keynote speaker today, and I'm looking forward to listening to her. Thank you.
Good morning. I'm sorry that I can't be with you in person today. Despite the determined and often courageous efforts of the malaria community, this year's World Malaria Report has confirmed our long-held fears. The pandemic has reversed progress for the first time in a decade. In the last year, there have been more than 620,000 malaria deaths, a 12% increase on the previous year, and each one was preventable. As the Minister responsible for Africa, it is most concerning that the burden has continued to fall heavily on the continent, particularly on the young, with under fives accounting for 80% of all malaria deaths. So we must be in no doubt, malaria remains a priority. We know strong health systems are vital for preventing and treating malaria, and that making progress on malaria is critical to delivering on our global ambition to end preventable deaths. And that is why the fight against malaria is a critical aspect of two papers the UK government is launching next week, on ending the preventable deaths of mothers, babies and children, and on strengthening health systems. It's vital that we all continue to do the things that will help reach global malaria targets. We must continue to pursue a targeted response, tailored to local settings. And we must continue to collaborate globally, sharing vital information to encourage robust disease surveillance. This will contribute towards the global effort to strengthen health systems, enhance global health security, and keep us all safe from preventable diseases. The UK has a long track record of investing in global health, particularly on malaria, a commitment many partners here today share with us. We will spend more than £10 billion this year on international development, including £1.3 billion on global health. This will help tackle key challenges of our age, such as global health, climate change, supporting women and girls, and responding to humanitarian crises. We are also using our aid and UK scientific experience to fund research into a new generation of anti-malarial medicines and diagnostics. The creative approaches taken by partners and countries where malaria is endemic, such as bednet and indoor spray campaigns, are perfect examples of how we can adapt to meet the needs of those most vulnerable. Malaria vaccines were a bright spot in a difficult year, with the World Health Organization recommending the world's first malaria vaccine for children, and Gavi's decision to approve a malaria vaccine program. These positive steps provide hope for driving down malaria cases and driving down malaria deaths. If we are to maintain our defences against the disease as it continues to evolve, we must continue to invest in research and innovation. Tackling malaria not only saves lives, it allows children to stay in school, mothers to stay in work, and economies to grow. Malaria reduces GDP growth in African countries by an estimated 1.3%. So reducing the malaria burden on pregnant women and girls will not only help unlock their potential, it will also boost prosperity. When we help countries grow through enterprise and trade, we help create freer, more prosperous countries and more prosperous and freer people. I do not doubt that we will continue to face challenges in the fight against malaria. However, if we continue to work together and develop and roll out new tools to protect those most vulnerable, we will lay the foundations for eradication and hopefully consign this disease to the history books. Thank you.
Well, my thanks then to Minister Vicky Ford for that particular statement, and also our huge thanks, of course, to Helene, who I'm sure you're going to stay with us through the course of the conversation as well, because I know you want to hear from our panelists. But obviously, as Minister Ford was just stating there, UK leadership is going to be vitally important over the course of this Parliament and, of course, beyond as well. And it's really great to hear that continued commitment and investment as well. Now, it's my pleasure then to discuss the World Malaria Report in much more detail, the findings of it, and of course what more Britain can be doing to try and eradicate malaria. And I'm delighted to introduce our panelists then this morning. Dr. Linda Yueh is a fellow in economics at St Edmund Hall, Oxford University, and also an advisor to the UK Board of Trade. Linda, good to see you. And Vermeersch is Vice President and Head of Global Health Market Access at GlaxoSmithKline, GSK. Professor Azra Ghani is Chair in Infectious Disease Epidemiology at Imperial College London. Good to see you, Azra. And Dr. Cristina Donini is Senior Director for Translational Medicine at Medicines for Malaria Venture. So Cristina and your fellow panelists, welcome to you all. I'd like to invite each of you, before we get into an in-depth discussion, to make some opening remarks, your reflections on the report itself. And then, as I said, we'll get into questions from me and questions hopefully from the audience as well. So Linda, if I can come to you first, please.
Thanks very much, Hannah. I know we want to get into a conversation, so I'm going to keep my remarks brief. I'm going to try and stick to the 2 minutes. What I actually want to stress is a couple of things. So I'm a trustee of Malaria No More UK, and I'm absolutely delighted to be. And my work looks a great deal at how, in a project I've been leading for the past few years, how the UK can strengthen its economic diplomacy. So malaria, there's 3 different ways in which malaria it's a bit of an exemplar. It's an example of how the UK can position itself in the 21st century. So let me just go through each of those briefly. The first is around fostering economic security. The second one is around the UK's global role with respect to global public goods. And the final one is the UK's comparative advantage and competitiveness. So malaria, in terms of strengthening countries' economic security, especially among some of the least developed countries, and we've heard there from Helene about the very high incidence of malaria in Africa. Many of these are Commonwealth countries that have very close links with the UK. Studies show that eradicating malaria is correlated with foster economic growth and, most importantly, standards of living. So not just the growth of countries, but actually the growth of people's incomes. And by increasing economic security, that really does pave the way for prosperity and for much greater linkages between countries. And of course, that is something the UK's very focused on, linking how you can try and use the funding that it's putting towards other countries and try to link that to a broader promotion of multilateralism and greater amount of openness. So I think, eradicating basic preventable diseases is a great example of how you can do that and increasingly bolster cooperation in the world. And just on that point of cooperation, global public goods, because of the pandemic, because of COVID, and also other global public goods like the environment, are increasingly in focus, and rightly so. And having a global role for the UK in a very fragmented world in many ways, with the tensions between countries, US and China come to mind, but there are certainly others. By promoting how we can further global public goods, like around health, it strengthens countries' domestic public health systems. So by being able to prevent and detect malaria, generally the countries that have done this have better overall public health systems that can also alert everyone in the world for other diseases like the emergence of COVID or new variants of COVID. So there's a direct link between what the UK's global role could be and how its focus on malaria can help achieve that. And then just finally, an area, of course, as an economist I'm very focused on is the UK's competitiveness. Showcasing how strong we are in life sciences is a way of shaping a comparative advantage. And I think that, again, looking at the trends of the 21st century world, the UK has quite a lot to crow about there. And I think it's about linking the success of companies like GSK and their work on malaria to the kind of ecosystem that creates for the UK in terms of higher wages, higher jobs, and innovation. So I think for all those reasons, there's a great rationale for why I'm a trustee in malaria for UK. I think it links very well to some of the work that I've been very keen to focus on, and I look forward to discussing this much more in our panel.
Thank you very much, Linda, and we look forward to hearing more from you as well. Fascinating to hear about your take on the economic perspective as well, and economic diplomacy in particular, which is going to be so crucial to Britain's role going forward. May I invite now Anne Vermeersch to come and unmute yourself and then make your introductory comments. Anne.
Yes, good morning, everyone, and thanks a lot for the opportunity to speak. For GSK, actually, this year has really been a very special year for malaria, with all the progress made, particularly with our malaria vaccine. And further in the discussion, I'll be happy to share more about that. But first, looking at the malaria report, clearly we see the impact that COVID has on the already stalled progress actually on malaria, and more particularly when we look indeed, as someone said already, 80% of malaria deaths are in children under 5. I think that's a huge number, and it's clear that more action and more efforts are needed, most on the one side to increase further access to the already existing malaria prevention tools, but also further research is clearly needed, and we do not yet today have all the solutions to tackle malaria and reduce really this big impact on children and people, especially in sub-Saharan Africa. As a UK company, we are committed to global health, and our approach is science-led. We want to do things that are sustainable, and we want to focus on impact, and malaria is absolutely one of the key priority areas we focus on. A great example of our malaria work has clearly the RTSS malaria vaccine. So it has already been mentioned, it's the first vaccine that actually now this year received a recommendation for broader use by the WHO. So that's a major milestone finally achieved after more than 30 years of research. We also have a tafenoquine product, which is a single-use, single-dose radical cure for malaria vivax. And that is already registered in a few countries. And we also continue to innovate because it's clear we don't yet have all the necessary solutions to tackle malaria. And so we really look particularly at new opportunities to help tackle anti-malaria drug resistance. So what is now the role that the UK can play? Well, absolutely, for us, it's a critical role, both in helping to enable access to existing solutions, but also to continue to support R&D. And actually, we see 3 ways where the UK is playing a critical role. First of all, more in general, creating a supportive environment for life sciences, like what GSK is doing, but also very importantly, the role that the UK has in both funding, but also playing a leading role and voice in global organizations like the WHO, Gavi, Global Fund, UNITAID, Access, MMV, others. I think that's absolutely critical, not only for the funding perspective, but also to have a voice in the policy decisions that need to be taken, absolutely critical. And then last, also the funding and the supporting of the UK scientific research community that is working on malaria. So on all of those topics, we can further in the discussion go more in detail, but I think absolutely very important priority for us at GSK, and really be delighted of all the collaboration we have already with the UK over the last years and going forward. Thank you.
And thank you very much indeed. And we look forward to hearing more from you as well. And Professor Azra Ghani, over to you now, please.
Good morning, and thank you for inviting me to speak today. I mean, my reflections on this report are clearly these figures are really sobering, and it's really upsetting to see progress being lost. But I'd also just like to point out that, I mean, it's been a challenging year, and I think credit has to go to the national malaria control programs, who did manage to get things, life-saving interventions such as the bed nets out to such an extent that they minimized the impact of this huge disruption that we've all experienced through the COVID pandemic. So whilst, of course, numbers have gone up, I think it's still possible, I'm still optimistic that we can make more progress. Coming from a science background, the UK is incredibly strong in this area. And while there are a number of challenges, for example, drug resistance, insecticide resistance, and of course, a limited budget, there is a lot more progress that can be made. We've already just heard from Anne about the RTSS vaccine that GSK supported. It's really an incredible milestone to hear at the same time that we now have both funding for that, recommendation and funding for that. And that will start to be delivered across Africa from next year. So having a vaccine has got to be a great addition to the arsenal. And there's a lot of further development of new vaccines that may have higher efficacy or indeed be also cheaper to manufacture. There's a lot of progress, of course, in other areas as well. Continual updates in terms of thinking about how best to control the mosquito populations, new diagnostic tools, and new drugs to combat anti-malarial resistance that we know is growing worldwide. So science is really critical to being able to develop all of these new tools, but we also need to be able to be smarter and think about how best to deploy them. Funding is inevitably always going to be limited. And I think a huge investment has actually gone on in the last few years into thinking about surveillance, the important role it plays for malaria, as well as, of course, other diseases that protect us all. So by knowing better where malaria is, countries are able to better target resources and really optimize the tools that they have available to keep driving down the burden. And this will, I think, become critical as we go forwards. And we know for those countries that have successfully eliminated malaria, surveillance was probably one of the key tools in their arsenal. The funding obviously is an issue, and I think it's really important for us to keep highlighting the importance of controlling malaria in the context of all other diseases. So malaria swamps health systems in African countries. And this effect means that other important issues aren't able to be addressed within the health system. So by eliminating malaria, or reducing the malaria burden, we're going to have a wider impact on health in these countries. And the final point I'd like to make really is about science. We know that the UK is incredibly strong in the life sciences, and indeed many of the scientists that have been involved in malaria research over the last decades were then available, of course, to respond to the COVID pandemic. So there's a multiple impact of investing in science. But I think going forwards, what's critically important is to also invest in science in these African countries. There are fantastic scientists, but their resources are limited. And if we can grow that scientific base through partnerships and through funding, then there will be this next generation of scientists able to respond to malaria, but also other disease threats as they emerge. Thank you. I'll pass back now.
Azra, thank you very much indeed. And last but by no means least, we hand over to Dr. Cristina Donini. Cristina.
Yes, thanks, Anna, and thanks to Malaria No More for inviting us to participate in this great event. I think that a lot has been said by the panelists already. What we could add from an MMV perspective is that Indian malaria and neglected tropical diseases is a key target of the Sustainable Development Goals agenda, which is supported by the UK. And UK, we have heard and we know, has been at the forefront in contributing to the global health impact, including malaria. At MMV, we have been very fortunate to have the support of the UK since actually MMV inception in 1999. And we have worked with numerous partners from the UK, from scientists at Imperial College of London to institutions and to pharmaceutical companies. Anne mentioned, in collaboration with GSK in 2018, we got the approval of a new therapy for relapsing malaria, tafenoquine, and together we are working to facilitate the access of this medicine. Yet the numbers are still distressfully high. We have 241 million cases per year, And as Baroness said, and many others, more than 600,000 lives are still taken by a preventable and treatable disease. If you put it into perspective, it's the city of Glasgow that dies every year of malaria. And we need to stop this. We must act. My panelist colleagues have said it. We definitely need to step up investment. We need new tools. We need new approaches. We need new medicines to tackle this disease. And to reach the 2030 global malaria targets, which is to end the disease, we need to act now. We can't stop. We've done a lot. We've done a lot of progress. Yes, yet we've seen that since 2015, the progress has slowed down. We shouldn't really talk about a plateau, but there's been a slowing of progress, and this cannot happen. We need to accelerate progress instead of slowing it down. And how can we do that? With continuous support of partners and of government, such as the UK, we can defeat malaria together. And I look forward to the conversation that is going to continue now. Thank you, Anna.
Cristina, thank you very much. And thank you to all of our panelists for those opening remarks. Now, I have a few questions just to kick things off. And just a reminder to the participants who are joining us in the audience as well, please do pose your questions as we're going through the conversation as well. There will hopefully be time at the end so that we can get to as many of them as possible. Everyone hopefully is unmuted then, and we can get going with our conversation. And my first question is really, given the fact that the report itself, the World Malaria Report, is quite a sober reading, in that malaria deaths are now at the highest level in nearly a decade, which is hugely troubling, of course. Then Anne, you've already touched on this about the importance of R&D, but how important, given that we are now at this sort of devastating time with malaria still now increasing or on the highest level, how important is it that we continue to invest in research and development, in R&D, to develop new tools, new tactics to try and beat this disease?
Yes, no, absolutely. And in my opening remarks, actually, I already said that we have now actually new tools, and we have a few tools, but clearly today, that's what the report clearly shows, that it's not enough, and more tools are needed to find a real solution and to solve the problem, hopefully, one day. And related to that, clearly, it's not only that more research and work is needed, but I also want to illustrate with some examples how the role of the UK is absolutely critical in supporting actually that further research, not only as funder, but also as, I would say, a leader and a voice, and a country that actually influences policy related to research and advancing those new malaria tools. So I wanted to give just a few examples from RTSS that gives idea on what more can be done. So for instance, if you look at the malaria vaccine, first of all, at some point, I think it was in 2019, we started this malaria vaccine implementation program, organized by the WHO. And that's actually what's happening in 3 countries, in Ghana, Kenya, and Malawi in Africa. And in order for that implementation study, so it was like a feasibility study on implementation of a vaccine to happen, we had Global Fund, UNITAID, and Gavi actually bringing the funding together for that to happen. And clearly the UK, as one of the key funders of these organizations, have played an important role. So one way of advancing R&D is clearly to have the funding for these kind of programs as well. In addition, actually, we heard earlier on that the malaria vaccine have now been included in the funding of Gavi. And again, UK is clearly sitting at that table and very supportive of that decision. And this is absolutely needed. It's not only to do the research, but one actually a product is available in order to invest in the necessary capacity and manufacturing scale-up of a vaccine. It's important that there is a funding mechanism that will help implement a vaccine into the countries. And Gavi is, of course, a very important mechanism there. Another example related to RTSS and the link with UK was for funding was also Gavi and MedAccess, who actually put a new mechanism in place to help us upfront fund manufacturing at risk. So before we had the news on the malaria WHO recommendation or the Gavi board decision, we were already producing and scaling up manufacturing with support from Gavi and MedAccess to enable that. Another example of importance of research is the UK support to the research community in the UK. Like, for instance, the London School of Tropical Medicine and Imperial College have really already done massive malaria research on several products in the past, but as I said, more is needed, so we would certainly welcome that to advance going forward. And just one example I wanted to share is the London School study together with African partners, where it was actually looking at using the vaccine in parallel in combination with seasonal malaria chemoprevention, and that actually showed that it could further reduce the impact on mortality on children in settings with seasonal, very high transmission of seasonal malaria. So again, there is work to be done at companies as GSK on further research, but also the collaboration with all of those organizations, other scientists in academia, organizations like WHO, Gavi, Global Fund, and bringing all those players actually together to advance also the right research and to really leverage the knowledge and expertise sitting in these different organizations. It's absolutely critical. And well, I think my example showed that around malaria, a lot of that is available in the UK, and therefore for us very important to continue for the new tools that we need to develop, where we're looking more at how can we find new medicines that can help tackle the resistance of some of the current treatments. That's absolutely a priority going forward, and so we certainly would hope that we can continue to work together to advance those tools.
There's always, more to be done, really. I can see everyone sort of nodding along as you were giving all those examples out of what is in place and what needs to be in place as well. And Azra, on that, particularly on the role of vaccines, I mean, affordable vaccines and the rollout of them is of course hugely welcome, and celebrate that absolutely. But is it enough in and of itself, having this this amazing breakthrough that we've had this last year? Is that enough?
Yes, I mean, it's clearly a really important breakthrough, and just having the milestone of a malaria vaccine that goes into the system, that starts to be delivered, it is hugely important, and demand is incredible. So we're very confident that vaccines are what is wanted by the people living with malaria, and that would be really helpful. No single tool is ever going to be enough on its own, and we know that malaria is highly transmissible, and it's a very challenging parasite to make a vaccine for as well. So the tools aren't perfect, and we've all got very used to very high efficacy vaccines in the last year and a half. Malaria is different. It is challenging because of that repeated exposure that happens every single day living with the infectious mosquitoes. So if we combine tools, we are going to be in a much better place, and that's certainly the approach that the world is taking. We combine the vector control, we combine, as Anna said, things like chemoprevention, so giving drugs to people to protect during the highest risk periods, the vaccine on top. That layering approach will just gradually get at every part of the transmission cycle and hopefully drive things down. So we will get these new tools, I think, and there'll be other ideas that we haven't even thought of now that can help.
And Linda, if I can come to you on the sort of the role that British science is playing, not just from the scientific perspective, but from an economic perspective as well, from the brand Britain perspective. How important is British science in the sort of post-Brexit brand Britain, global Britain that we're trying to portray right now?
I think it's hugely important, because I think what we are, lots of countries, but I think the UK is very much focused on it because of Brexit, having to look at its role in a very different 21st century world. And in this, the trends of the 21st century are, there's a lot of them. We won't have time to go through all of them in my area, but I think among the things to really stress is innovation is going to be extremely important to lift standards of living in the UK and in other countries. Life science is a terrific example of a sector that does that. It's innovative, it's going to improve people's lives, it can raise productivity, it's R&D intensive. These are all the kinds of things the UK would do well to stress, because we have these strengths. And again, when you look at how many countries are struggling with raising growth, raising productivity, how they link that to their global role. And I think, you know, some of the strengths of the UK are absolutely worth showcasing. It'd be good for countries affected by malaria, and it would be very helpful to, you know, position the UK well. And again, I just want to stress, it is, you know, the 21st century world has a lot of, you know, challenges, and then we're covering a major one now. But the opportunities are also, you know, significant on the economic front, and I think that's what, you know, this sort of examination of where the UK stands. I very much, you know, think life sciences should be a major part of that.
Yeah, and the UK is obviously a big backer of the Global Fund, and when we're talking about new tools and resources that have been developed already and that can be implemented and, you know, put into place on the ground, I mean, what kind of role would you say is the Global Fund playing? How big a role is the Global Fund playing in getting these new tools actually out there? And that's really to anyone who'd like to chip in on that. I'm going to have to pick on someone.
I can start. I mean, the Global Fund is critical. It's the biggest donor in terms of malaria money going to countries, and so much of the current tools are supported and by the Global Fund. So it's really, really important that funding continues, that the donors continue to contribute as the upcoming replenishment cycle starts.
Yeah. And you know, this year's report, World Malaria Report, has highlighted the sort of the disproportionate impact that malaria has on women as well. And Cristina, I wonder if I could come to you first and say, you know, how can we improve outcomes for women, but also why is it that women in particular are being so disproportionately affected?
Sure, I can start maybe with the last one. So I think it's historical. We might remember all the accident of thalidomide in the late 50s and early 60s. And this was one of the reasons why women were actually excluded from clinical trials, for example, to protect them as a child bearer. So women with childbearing potential and pregnant women were not included in clinical trials, which was to protect them, yet this has ended up with a lack of data in this particular population, which is one of the most vulnerable. We have an 11.6 million pregnant women that are affected by malaria from the last year, just in Africa. So this is huge, and this is a very underserved population. So we need gender equity. We need to fill that gap. And how can we do that? At MMV, we are working with partners like the Liverpool School of Tropical Medicine to fill that gap, the data gap and medicines gap. How can we do that? We are working with the Liverpool School of Tropical Medicine with pregnancy registry. So what we're doing is gathering data on efficacy and safety of existing anti-malarial options in pregnant women. So this is on one end, but then we have also to go all the way back to discovery. We need to start from the start of the game. So we need to look at tools and models as well to make sure that the new generation of compounds that are coming forward can be used in pregnant women. We need to start including pregnant women in clinical trials. So we're studying with women of childbearing potential in very controlled settings. Yet pregnant women should be studied prior registration in order to fill that gap and have therefore medicine that can be used in pregnancy. We need to remember that a pregnant woman means that two lives are at stake: is the life of the mother and is the life of the baby. If the mother dies, the baby dies. And if the mother survives, the baby still can have problems. We have stillbirths, 20% of stillbirths, and newborn baby with low birth weight, which eventually could lead to development issues. So it's a major problem that we need to tackle, and we can do it only with stepped up investment, as WHO says.
And Anne, I want to bring you in on this as well, because we're talking about women. I guess women shoulder much of the burden of primary care. They are predominantly frontline health workers as well. Yeah. Of course, on top of that, they are obviously carrying the children, and then mothering young children as well. And young children, so
yeah. I think one aspect I was just that came to my mind when I was listening to Cristina is actually, now that we will have a vaccine, the vaccine will of course use the usual vaccine immunization system to reach the mothers and their children. So that's another route of normally delivering malaria tools. So I think we really have now an opportunity to extend the access also to pregnant women through the immunization system where the vaccine will be delivered. So it may be an opportunity actually to also bring the discussion on malaria and actually broaden access to some of the malaria teams, because we know that vaccines often reach the most harder to reach population. They really have the way the immunization programs are delivered, and also Gavi has a very big focus on reaching the hardest to reach. So one element that we also hope now is that with this malaria vaccine, maybe we can also use actually the immunization system to broaden the prevention and the information to mothers about malaria treatment for themselves, but also for their children. So
and Azra,
that's an opportunity.
Sorry, apologies, Anna, I just jumped in before you'd finished. But Azra, I was going to say, aside from the immunizations, is there anything else that we can do to sort of improve gender equity, or on the side of gender equity, in to ensure that no one is sort of left behind in all of this?
Yes, I mean, it's really a case of access, and just access to the basic tools, the basic medicines. It in itself is a big issue, because obviously the mothers are the carers. They will have other children as well, so having to go a long way in order to get treatment or try to get a child to hospital is a real challenge, and it has an economic impact as well on those mothers taking the time out, trying to spend what's a large portion of their funds to access any treatment for their children is problematic. So the whole system, it needs to work together and needs to be improved.
I mean, to improve access, presumably that means improving, redrawing up the health infrastructure in general in a country.
No, I mean, there's been a lot of progress made, for example, with community health workers. So we know that if children get treatment early, they are far better to have a good outcome and be much less likely to develop severe forms of malaria and therefore need hospitalization. So having people in the community there to be able to diagnose with a rapid test and then provide treatment really could have a major effect. And many countries have these programs in place.
I want to move on slightly, because we've talked about malaria deaths, which is obviously a devastatingly high number still. But malaria can also maim, impact survivors for the rest of their lives as well, and have an impact in a multitude of ways. And we know that the symptoms of disease can then make it very hard for people to stay in employment, in education as well. So, Linda, if I could come to you on that, I mean, what kind of impact does malaria left untreated have on a country's economy over time?
Hugely devastating. So the statistic that I mentioned, a number of studies find correlations where if you eradicate malaria, or indeed if you reduce malaria, you can see a corresponding increase in standards of living and faster growth. So the mechanisms through which that happens is, there's a number of them. I mean, one of them that Azra has already mentioned is absenteeism. So literally people aren't able to produce the output that they previously had. Educational disruptions, because so much of malaria falls on children. And when your human capital is affected from a young age, that has a scarring effect on the rest of your life. And thinking about the importance for a lot of developing countries of foreign direct investment. So foreign companies locating there to produce, to sell, to offer services. Having a basic disease that is eradicated helps incentivize other countries from wanting to think of your country as part of a supply chain or as a base, for instance, going into parts of Africa. So you see examples of this in Asia, where they have eradicated basic diseases, and malaria is obviously still an issue in a number of those countries, but the ability to control it makes East Asia, which is really the center for a lot of supply chains, attractive for people to want to work there, to live there, to produce there. So there's a number of reasons why this disease, which is preventable, really needs to be prevented and eradicated. The knock-on impact in terms of prosperity is never want to say anything's that certain in economics, but I'm going to say this is pretty certain.
Yeah, and everything's linked, isn't it, as well? So you're talking about the economic side, but the, you know, global health security at large is also threatened even more by the existence and the increased existence of malaria as well, given the fact that you have now these blind spots. And Cristina, I wonder if you can talk about what we mean by blind spots, that malaria and other fever diseases are going undiagnosed and therefore that other diseases can emerge that threatens the whole globe, irrespective of where it emerges from initially.
So I believe that one of the big threat that malaria has compared to other diseases that have been eliminated is the fact that we have a lot of asymptomatic patients. So actually, they do not have any symptoms. So if you don't have any clinical observation, it's difficult to detect them and therefore treat them. This is one of the blind spots that malaria actually presents, and is one of the big challenges for researcher and also for having the right medicine, because you can treat a patient when you know that the patient is sick, but if the patient doesn't know that he's sick, is not a patient, he doesn't go to the clinic and therefore doesn't get treatment. And having that reservoir of parasites in people, it just, you know, feed back into the life cycle of the disease, and therefore, you know, the human then transmit back to the mosquito, and then the mosquito becomes again infectious. So this is something that we're looking at, and, you know, MAC-DRAS administration would be potentially one of the answer, or having compounds that actually block the transmission from human to the mosquito is also key to get rid of that reservoir, or at least reduce it to a level where we can reach elimination.
And Anne, you mentioned in your opening remarks as well about the importance of UK investment in science, in R&D, and more broadly as well. I mean, this is a very general open question, but would you say that British global leadership on this particular issue is more needed than ever right now?
Yeah, I think it's absolutely the case. I think, first of all, well, certainly what we see from our perspective in GSK and RTSS on tafenoquine and all the work we have been doing and on malaria, I think in the examples that I shared before, it's clear that we would not have been able to do the same without the support and all the collaborations that we had in the UK environment, I think. So it's absolutely critical to continue with that and to build further on that expertise and knowledge, but also the commitment of the different organizations to together be part of solving the challenges on malaria. So I think that's absolutely critical. And clearly there also maybe come back on one point beyond the further efforts needed on R&D to build new and additional and more effective solutions and tools. I think really also the importance of the role that the UK plays in partnering with these global organizations like the Global Fund and Gavi that we are mentioning. I think it's absolutely critical to further enable access, but also to help strengthen the health systems, right? I think that's a key piece for enabling access on the malaria tools, but also it will give better pandemic preparedness as well in general. And the last piece is, of course, on disease surveillance. I think those organizations can also help strengthen that. And as GSK, for instance, there we partner with organizations also like AMREF and Comic Relief on those fronts, the health system strengthening, disease surveillance, training healthcare workers. Yeah, I think beyond pure research support, I think these aspects are absolutely critical as well. And doing that together with key partners in the UK is absolutely critical.
And really eloquently then about, you know, the importance of Britain partnering rather with other global organizations. But Linda, I wonder if I could come to you to respond to the question about Britain partnering with other countries, with foreign allies, when it comes to boosting economic growth in countries and also tackling malaria at the same time.
Yeah, so I think when we look at how important global public goods like health, you know, as we know, we learned from COVID that what happens in one country affects us all. And it's the same for malaria to different degrees. But what that stresses is that global health is a public good, which can only be addressed through partnering between countries. And I think we can't actually stress this enough, because as we've already heard from the other panelists, if you have a public health system that's strengthened and can have better surveillance, it's not just malaria you would detect, it's actually other diseases as well. So thinking about how you can better mobilize efforts in funding, partnering and focusing, on eradicating malaria in some of the most countries in Africa in particular that we've been discussing. We also know in terms of COVID, that's also a major place that we do need to focus on. So all of this can have, a very good, another economics term, but I think you'll get what I mean, multiplier effect in terms of improved outcomes for us all. So I think it's absolutely critically important that the UK, funds the Global Fund, partners with, these organizations that can make this concerted effort highly effective across countries that need it. And expertise is I think we know this. We always know this more for science, I think, than maybe my subject, which is a social science, but expertise is absolutely key. That's why you also need partners to do it effectively.
Yeah. As well, exactly. Everyone sort of mentioned, I think, in their opening comments about COVID-19, and it's sort of the elephant in the room, or the sort of the glaring brick wall that we're all staring at the moment, isn't it? The ongoing pandemic. I suppose one plus side, or if you can look at any positives from it, is that it has shown us how interconnected we are, and it's a great leveler as well, that we're all in this together, as it were. And I'm not trying to sort of quote politicians in saying that at all. But Azra, I wonder if I could come to you on this. Is it possible to coordinate community health systems at a global level in order to try and have some sort of global coordination of tackling malaria, in the same way that we sort of have an approach to COVID-19?
Yeah, I mean, well, I would say we don't really, things work at a national level in terms of health systems. So it's difficult to think of a global coordination, but what there is, of course, is a global network of sharing information rapidly. And we've seen that, for example, I mean, just this week from South Africa. South Africa's scientists have been fantastic in generating information that we need to know for COVID. And that scientific network, but also the cooperation between countries at a political level as well, is incredibly important. And we know that having political commitment in malaria endemic countries is a key aspect of trying to drive down malaria. And in just the same way as we have had that sharing of information, the political commitment and between countries to try to address the COVID pandemic, having that same network for malaria is going to be critical. And there are such networks. There's the African Leaders Malaria Alliance, which has been really important in tracking what's happening with malaria and holding countries to account. And nobody wants to be the bottom of the table if you start ranking where things are. So that really does drive people to act. And if the political commitment is there at the top of the country, then that also enables the health system, the health programs to function better.
And Anne, if such global cooperation were in place when it comes to tackling malaria, how far stronger do you think the UK would be in terms of facing down what is, I guess, an inevitable next pandemic?
Can you just repeat the question for me, please?
I was just wondering how far will the UK benefit, would Britain benefit from there being global cooperation in place to tackle malaria, in terms of how on a domestic scale the British people would then benefit from this, because when the next pandemic comes along, whenever that might be, we would have strengthened systems in place to tackle it better?
Yeah, I think bottom line in many ways, right? So first of all, actually what we see today with COVID, on the fact that in so many of the countries in the South, the vaccine coverage is just still so low, and actually so many people still to be vaccinated, that actually continues that risk, because people are traveling around. And so as long as Sad Berkeley from Gavi says it this way, we are not safe until everyone is safe, right? So I think these viruses, of course, they don't know borders or boundaries. So I think that really shows how vulnerable we are if there is a disease arising any pandemic can be, even at smaller scale, but in one area in the world, how quickly actually travels around the world is clearly what we have seen with COVID. So for me, absolutely, that's why this global coordination for these particular diseases is so important. And actually we see it with flu every year as well, right? To be globally coordinated, to put the right control mechanism in place, hopefully in the future with better pandemic preparedness, if we can control better in one place by more rapid identification, maybe we can have quicker solutions to control and to avoid the spread. But of course, we never know where the next pathogen will emerge and in which country or which region will be first and mostly tackled. So I think that's one aspect, I think. So just to because viruses travel around, to protect one area and be organized to in a way try to control early on, I think is absolutely critical. But the other element of it for me is related to, for instance, all this vaccine development that we have seen in the case of COVID. It could happen quickly because everybody, all key countries actually are willing to support, work with the manufacturers, work together on different levels in order to advance research. UK, again, in COVID has played a critical role as well to help advance the research of vaccine. And I think that's absolutely a key role that the UK need to continue to play, because once there is a solution, you can protect your own citizens, but absolutely it can also help control in other areas of the world. So for our next pandemic, even if it would not immediately hit the UK, if you can control it, help control it where it is, I think it's the best way also to protect the own country. So for me, yeah, making sure that there is a good coordination to rapidly identify new issues and have control mechanism in place and quickly focus the research resources to be aligned is so important, because you never know where it will hit actually. That's the key piece.
Azra, you mentioned something before, and I'm just wondering whether I interpreted it correctly or not. But you said about the focus of the British scientists or scientists globally focusing on COVID, obviously over the course of the last couple of years. And I'm just wondering whether that focus on COVID-19 has actually negatively impacted the focus on malaria, in that specialist scientists have been drawn away from malaria to focus on COVID instead.
I mean, it will inevitably have had some impact because the world's scientists have turned to COVID in a sort of acute crisis. But there's still a lot of work going on malaria. A lot of scientists are still continuing their research in that area. And I think what it's really shown is that we need the world to collaborate. Scientists need to collaborate, need to be open and free to collaborate, but also that investing in science in one area for one disease has broader benefits in terms of having that scientific base ready to respond to the next global health threat. And really what we need to have is that scientific base in every country, but particularly in Africa. And because malaria is such a big problem in Africa, investing in scientists working on malaria is an obvious thing that should be happening. And that will really help us as well in terms of emerging threats that might come in the future.
Cristina, is there anything that you think we should be prioritizing then in the response to the COVID-19 pandemic, in order to protect all the hard-won gains that we have made in the fight against malaria?
Listen, if I go back to what you asked to Azra, I think that we have done remarkably well, considering the prediction and the forecast of WHO was they were pretty grim, and actually it wasn't that bad. So I think that scientists has continued to tackle malaria. But for example, what we have seen was disruption in having medicine to the vulnerable populations, such as pregnant women. So the intermittent preventive therapy in pregnancy was decreased of 2%. So this is something that shouldn't happen. And how can we do that? I think there should be investment, for example, in having local manufacturer closer to the patient. If you manufacture the drug close to the patient, in case of a next pandemic, then you would not have patients that are left out with no medicine at a certain point. When India was shutting down, China was shutting down, all the countries were shutting down, then, we did see a disruption into that. And we're working to avoid that at MMV. In terms of responses, what we also need our tools in R&D to, how do we face the next pandemic? We don't know which virus will hit us, if it will be a virus. So what we've done at MMB was, for example, to come up with a pandemic response box and a COVID box. So we have 400 compounds in the pandemic response box amongst virus and bacteria, against virus and bacteria. And for the COVID one, we're marketed and in development compounds that actually have a known or predicted to have a mechanism against the SARS-CoV-2. So all those tools need to be available to be ready. But how do we have the tools if we don't have investment? So again, it's a broken record, but we cannot stop the investment. We need to step it up.
Well, unless anyone else wants to add to what Cristina's just said, then I do have some questions from our audience as well. So shall I move on to them? And many thanks to the audience as well for posing your questions. The first one that I have is coming from Prudence Hamed. Thanks, Prudence. And she says, agree that the tools that we have enabled elimination in many countries, but are not optimally employed or deployed in Africa. Access to rapid and effective diagnosis and treatment is essential to remove the human parasite reservoir. How can we promote this access and learn from countries who have eliminated malaria with a strong focus on surveillance and access for remote populations? And that's not directed at anyone in particular, so please raise your hand and then the floor is yours. Cristina.
I think we have to work with the national regulatory authorities in the countries. We have to work with the ministry in the countries. It has to become a top priority in the country as well. In the countries where we reach elimination, is because we had a 360 approach. So not only from providers of the compound, but in order to have access to medicine, it has to be become a standard of care. It has to be a WHO pre-qualification compound. So we need to have an engagement also from WHO and the country at the national level to make sure that the medicine are not only accessible, but they are given to patients.
Anyone else want to respond to that question then from Prudence about learning from other countries who have actually eliminated malaria? Azra.
Yeah. I just would like to bring the example up of China. And China was formally eliminated malaria this year, and they did an incredible job in terms of surveillance, but also a key policy was getting treatment to people rapidly. So every case had to be detected and treated within 48 hours. And we know that will save lives as well. But having that approach to thinking about the system and learning from the Chinese, the systems they had in place, I think would be really helpful to many countries.
Okay, thank you very much. Another question, this is from an anonymous attendee. Agree that the Global Fund is absolutely critical. How can we ensure the Global Fund replenishment next year is a success? Linda, let me come to you first.
Oh, that's a really hard question, but a really important question. So I think how we can help support the importance of the Global Fund is just to make sure that we've all discussed in different ways how connected countries and different diseases and economic prosperity on the back of it, how linked everything is. So one of the, and I mentioned before, one of the ways in which you can always have a fantastic strategy and you can say there's all these linkages, but how do you actually execute it? How do you actually make sure it happens? Well, the Global Fund has a track record in doing exactly what it is that we need to eradicate malaria. And therefore, as a vehicle for all the things that Azra mentioned about sharing information, about deployment, all of these things, this is what countries need to act on in order to demonstrate that when they say we want to ensure that global public goods, that our global role is to promote prosperity, eradicate disease, and prevent, I say this boldly, prevent the next pandemic. This is where action needs to happen to meet those words.
And I have another question. This is coming from Amadou Boukar. Thank you, Amadou. And the question is, the latest report indicates that Africa carries 95% of cases, as you've all alluded to as well in this conversation, with Nigeria carrying the highest burden. How can the UK help Nigeria overcome this challenge, looking at it as the country with the highest population across the continent of Africa? I'm going to pick on someone. If someone does, Anne, let me come to you.
Yeah, well, actually, I think I've touched upon that in the discussion. I think where the UK here has a key role is through his, from my perspective anyhow, through its active role and leadership with those key organizations. So enabling Gavi, Global Fund, and other organizations to do the work that they can do very well, actually, with the countries, with the governments, working on political commitment in the individual governments, but also look on the field, ensuring funding, but also working with the organizations and in the country to deliver those different products. I think that's absolutely, I think directly what we can do. I think that's very important to continue that commitment to make sure that all those initiatives can continue and more, I think. And it's clear actually the challenge is so big that support and funding is needed for these implementation programs and help to enable access. And I think, yeah, that is, I think, absolutely the critical piece that we can do directly through those organizations that make the impact happen in the field.
Yeah, again, plays back into the previous question as well about the importance of the Global Fund replenishment next year as well, doesn't it? These organisations, they have to be funded in order to carry out the vital work that they're able to actually do.
Yeah, and actually, I would just say more meetings like this one, right, to raise awareness, speak about the situation of malaria, speak about this new report, should not just be about this week or this month because the report is out, but I think much more awareness need to be built, and also probably much more awareness about the role indeed that the UK is playing through these different organizations and how important the funding is. So these stories, I think, we need to tell, and I really hope that, for instance, with the example of the RTSS vaccine, which is the new, in a way, big news of this year on malaria, that in the next months, and we can actually show what are the next steps to progress, and that actually convinces people to be part of making that happen. And the same for other new tools and new data. I think making more noise about it will certainly help to for people to realize the importance of the role that the UK has to play.
Well, last year, make some noise about it then. I'll put the one final question to all of you, really, and it's really to ask you what your number one thing would be that you'd like to see from the UK government now to help end malaria. And that question goes to all of you. And Cristina, if I can come to you first.
More investment in R&D. R&D must continue. We cannot have new tools and new medicine like WHO is asking us if we don't have any investment. So, and WHO said it last year. I think there was $3.3 billion that were funded with a forecasted, actually, we were expecting 6.8. And they said if we want to reach the global malaria targets, which is to end the disease by 2030, we need to triple that investment. And R&D, we need a solid R&D pipeline. And in order to have that, we need more investment for all those scientists, all these British excellent scientists and scientists, as Azra said, in Africa, to have tools and resources to continue that.
And Azra, then over to you, the one thing you'd like to see the British government do.
Yeah, so the UK government has been one of the largest historical donors in the fight against malaria, and it is absolutely critical that that is maintained going forward. We have the Global Fund replenishment coming up. The most important thing is that funding is maintained and enhanced so that all these new tools that the scientists are working on, all the advances that we can make in terms of delivery and implementation of these tools is maintained, and we can drive down malaria. Without that money, we can't do that.
Okay, and Linda, to you next.
Can I just ditto what Azra just said?
Yes, you absolutely.
So it's just maintaining that, you know, that very, I think, very strong position on malaria and committed to continuing funding. And and encouraging actually other countries to do so because of all the wider benefits that we've discussed.
And Anne, over to you. The one thing that you'd like to ask the UK government to do in the short term, at least.
Yeah, as so many of my partner panelists have actually focused so much on the funding, I think I would just want to add and continue to play that leading voice that speaks up for malaria. And I think that would be great.
Okay, well, thank you to all of you for your contributions to this this discussion. Also, of course, to the audience for some really great questions as well. So my thanks to Dr. Linda Yueh, to Anne Vermeersch, Professor Azra Ghani, and Dr. Cristina Donini. I'm delighted now that I can introduce Françoise Vanni. Françoise is Head of External Relations and Communications at the Global Fund to fight AIDS, TB and malaria that we've just been hearing so much about, of course. And Françoise will be making some closing remarks about the important work of the Global Fund as we look ahead to that absolutely crucial replenishment conference next year. So Françoise, over to you.
Thank you very much indeed for the invitation, for the opportunity to speak at that important event, and for the opportunity to listen to this very insightful conversation. Thank you also for the very supportive comments regarding the Global Fund's role. I'm delighted to be here. So I would start by saying that as the second largest donor to the fight against malaria, the UK has been at the very forefront of efforts that have helped to save 7 million lives and prevented more than 1 billion cases since the year 2000. That's really remarkable. But after years of steady declines, and as many panelists have already mentioned, malaria cases and deaths are on the rise. Funding has indeed plateaued, and drug and insecticide resistance are increasing, risking a resurgence of the disease and loss of hard-won gains. While many countries with a low burden of the disease are moving steadily towards the goal of malaria elimination, as for example El Salvador or China, that have been certified malaria-free by WHO this year, high-burden countries are losing ground. Sub-Saharan Africa, and it's been mentioned, accounts for 95% of all malaria cases and 96% of all deaths in 2020. Based on the latest numbers, and is facing a catastrophic convergence of challenges that really threatens progress. Key challenges, of course, include the COVID-19 pandemic, but also the resulting economic challenges, humanitarian and health emergencies affecting more than 122 million people on the continent, emerging drug resistance and insecticide resistance, as well as an invasive species of mosquito from Asia and the Middle East that sadly adapts easily to urban settings and could lead to more outbreaks, as well as mutations to the malaria parasite that make rapid diagnostic tests less effective. So what we've seen in sub-Saharan Africa is indeed an estimated 12% increase in malaria deaths in 2020 over 2019, which shows the impact of even moderate disruption to services. It's a very significant impact in a short time. Disruption to malaria services caused by COVID-19 led to an alarming increase in malaria deaths and cases last year. And there was an estimated 241 million malaria cases and 627,000 malaria deaths worldwide last year, which represents about 14 million more cases compared to 2019 and 69 more deaths. As we said, preventable, avoidable. Approximately 2/3 of these additional deaths were linked to COVID-19 disruptions. So not all of them, but a significant proportion. Now, I would like to talk a little bit about the response, because indeed, the worst case scenario of a potential doubling of malaria deaths that had initially been projected by WHO early in the pandemic has not materialized, fortunately. And this is very much thanks to rapid and robust response supported by partners like the Global Fund, but also others. Countries have been able to mitigate such an impact. The Global Fund itself has awarded over $4.1 billion since the start of the pandemic to over 100 low and middle income countries to help them fight COVID-19, as well as protect life-saving HIV, tuberculosis, and malaria programs. And it has undoubtedly helped mitigate the negative impact that was expected or feared from COVID-19. And malaria, as we know, and it has shown over the years that we must stay ahead of it to eliminate it, or it wins the race. We are either winning or losing. There is no middle ground possible with malaria. The good news is, though, that successes in fighting drug-resistant malaria Greater Mekong region show that a well-funded joint effort actually works. So the Regional Artemisinin Resistance Initiative, which is the Global Fund's largest regional grant that was launched in 2013 in response to the emergence of drug-resistant malaria in the Greater Mekong region, is really working and delivering results. We have invested more than $244 million through this initiative, which was really aimed at accelerating malaria elimination as a bulwark against drug resistance. And since the start of this initiative, malaria cases have dropped from 650,000 in 2012 to 42,000 in 2020. So I'm showing that example because it really shows that a well-funded, well-coordinated, well-designed effort can really deliver very, very significant results. And the Global Fund, it's been mentioned by many of you, is indeed investing in new tools, in new partnerships and innovations in many, many ways, including to pilot new mosquito nets to combat insecticides and drug resistance and make our interventions more cost-effective. We constantly seek to find new ways of working and new innovations that we can bring to scale to help countries control the malaria epidemic. Recent pilot used to generate the data for the WHO recommendations for the new we've talked about in many ways already, was funded by the Global Fund together with and in the pilots, it's that the RTSS vaccine was most impactful together with existing tools. It's been stressed already, the vaccine will be a very important complementary malaria control tool to be added to the core package of WHO, the recommended measures for malaria prevention. One tool alone won't do it. We need a combination. And the combination of tools includes routine use of insecticide-treated bed nets, indoor spraying with insecticides, malaria chemical prevention strategies, and obviously the timely use of malaria testing and treatment. The Global Fund provides 56% of all international financing for malaria. And the UK is the second largest donor of the Global Fund since the last two replenishments, and obviously a key supporter and a very strong voice in the fight against malaria, HIV, TB and malaria, HIV and TB, sorry, and in strengthening health systems. As the world continues to battle the COVID-19 pandemic, the UK government's investments and leadership in global health, including health systems and malaria prevention, have never been more important. These investments save hundreds of thousands of lives every year and are helping to build the health infrastructure that will help to prevent future pandemics, especially at community level. In autumn 2022, the US government would host our 7th replenishment. And we very much count on the UK to maintain its leadership role in global health and in the fight against malaria. We know that due to the setback from COVID-19, the needs for the 7th replenishment will be significantly greater than previous replenishments. At the same time, the investments that we are making in the malaria response are critical also for the response to current and future pandemics. In mid-February next year, we'll be releasing our investment case that will include our fundraising target for this replenishment. The investment case will also highlight the work that the Global Fund does to detect and respond to emerging disease threats, building on experience in our response to COVID-19. We very much stand at a crossroads. The impact of COVID-19 has been devastating, exacerbating existing inequalities, diverting critical resources, slowing access to critical prevention and treatment activities, and putting the most vulnerable people further at risk. We need to reinvigorate the fight against malaria and work together to build a healthier and more equitable world. We are in this together, and we cannot do it without the critical contribution of the UK. So a strong pledge for the 7th replenishment will be a tangible example of the vital UK leadership in global health. I thank you.
Thank you so much, Françoise, and thank you, of course, to all of our speakers and for everyone in our audience for your questions and just for your presence for attending today. I hope that you found the discussion useful. I certainly have. Please do follow up with colleagues at Malaria No More UK if you have any further questions, of course, or indeed if you wish to get involved now in the malaria campaign. I just closed this session by saying that Britain has a very proud history in the fight against malaria, and today Britain has the diplomatic, the scientific and the financial muscles that are crucial to helping reverse the increases in malaria cases that we're seeing across the world. In particular, as Françoise was just alluding to, the replenishment of the Global Fund next year is a key opportunity for Britain to reaffirm this commitment with an ambitious pledge. Please, please, do share your support and continue the conversation, as vital as it is, on Twitter, other social media as well. You can use the hashtag World Malaria Report and also hashtag End Malaria. Thank you all so much for your support and for your contributions. And we really hope to see you again soon. Thank you for having me. Take care.